Thanks, Robin. I really appreciate the opportunity to be here again. So, as you said, one of my latest endeavors that's keeping me busy here in my master bedroom closet is I am the host of the Ortho Show podcast, and it's really fascinating to me. Expert after expert after expert that I interview are all really messaging very similar things, and that is the way in which we practice medicine when we get through this pandemic is not going to be the same, and it won't be the same probably forever. So the idea of, as we emerge, and you talk about those J&J numbers, which are very encouraging as we go into the fourth quarter. So let's ask, how are we going to see all those patients? So are we going to have a waiting room filled with 75 people, which is where we are in my practice of 10 doctors? That ain't going to happen. Social distancing is here to stay. So are patients going to take 3 hours out of their day to come and get health care from a physician? Hey, maybe not. Maybe you'll be able to sit at home and be able to have that conversation and not take so much time out of your busy schedule. The bottom line is, Robin, is that we need a plan. So we've got, maybe 2, 3, 4 more weeks before we start reopening and starting to see these patients. And I urge all of you orthopedic surgeons out there in practice, whether in a hospital setting, academics, or whether it's in private practice, you should be organizing right now your thoughts and your energy as to how you're going to get through this with a discrete plan. So in our practice, we just named a new CEO of our practice yesterday. That is not a chief executive officer. That is a chief emerging officer. And we're going to put together a subcommittee within our practice that's going to look at the various options that are available, because we're still going to want to provide high quality, efficient care, but we're going to have to change the model and how it's delivered. So what are we going to do? So we interviewed a great Dr. Mike Greiwe from Ortho Live, which is one of the only HIPAA compliant telemedicine programs that's out there. So HIPAA's gone now, but I can tell you HIPAA's coming back. So you're going to need to have a HIPAA compliant telemedicine platform. You should start looking into that and thinking about that. Physical therapy is going to also change in the way we go forwards. We had a great physical therapy group on last program, but we also interviewed Dave Nichols, who's the CEO of AMP Recover, which is a physical therapy platform that's going to allow you to provide HIPAA compliant telemedicine so that your patients are going to get even better care. You'll have better tracking of your outcomes, and you'll be able to still now, most importantly for the physicians and physical therapists out there, be able to charge for your time. So those are the types of things that we're looking for. And I, as a physician, as I'm thinking about how am I going to treat my patients with osteoarthritis knee pain in particular, well, we're going to do telemedicine, right? I don't need a 70-year-old woman sitting in my waiting room with somebody sneezing and passing virus. Stay home. Let's talk. Let's figure this out. We can diagnose, what's going on, especially the patients where we've had previous x-rays, and let's have a plan. And so what I'm looking for in the plan when the patient comes to the office is to really have something that's highly efficient, that's timely, that's durable, that's going to provide this patient to come in, get pain relief for a predictable period of time. And that's why Zilretta right now is my go-to choice for the treatment of osteoarthritis knee pain. So it's a novel intra-articular injection of cortisone that provides up to 70% of patients are having significant pain relief out to 3 months. So that durability, that predictable action is something that for me is something that's very valuable for my patients. Now, I'm using other modalities still to treat osteoarthritis knee pain. One of my other favorites is iovera, which is a medical device that creates a temporary axonomesis to the nerves. And that can provide significant pain relief for outwards of 3 to 6 months as well. The only issue with the iovera right now is it does require about a 45-minute session with the patient. And many of our patients are hesitant in the setting of the pandemic at this time to have that long of patient contact. But we have had success with that, and we will use that going forwards as well. You noted at the start of the broadcast also that I'm the chief medical officer of Ortho Laser. We've had great success treating patients with laser treatment for osteoarthritis knee pain. The problem is we're in an unprecedented time of unemployment. People don't have a lot of extra cash. So laser is a modality that's a patient pay modality. Most patients are willing to pay to be able to continue. But at the moment right now, they're home, they're saving their money, and they're waiting for that paycheck to come so they can get out. I can also tell you, I'm not getting a lot of phone calls for patients that are looking for PRP or stem cells at this time, which is regenerative medicine. That's also something that's on the back shelf. So to summarize, my opinion is at this point, we need to really be focused on a plan to move forwards. Now is the time to do that. There are some great options that are available for you. Yes, I'm using Zilretta as my go-to treatment for osteoarthritis knee pain in the setting of this global pandemic. Really, thank you for the opportunity, Rob.